Hi, I'm Keisha, and today we're diving into a fascinating case study called The Mystery of the Numb Limb. So, to sort of set the scene, we have a 45-year-old office worker, someone you might see every day, that starts experiencing this really bothersome numbness and tingling in their left arm and hand. It's not just a little pins and needles feeling that goes away quickly, it's been getting worse over several weeks. After a thorough examination, the doctors suspect that a nerve might be getting compressed somewhere along its path. Our job today is to act like medical detectives, figure out what's most likely causing these symptoms, and explain how the body's incredible nervous system is involved, and then propose a plan to help our patient get back to feeling normal. So before I begin, I have not a diagram, but it's the nerve pathway. So first it's going to hit our sensory receptors, then our spinal cord, then our motor neurons, and then it goes to the muscle, which is what we output. Okay, our nervous system is truly amazing. It's our body's super fast communication network. It's divided into two main parts. First, we have the central nervous system. That's sort of like the command center. It houses the brain, and the spinal cord. All the major decisions and processing happens here. Then we have the peripheral nervous system, which is like the communication line stretching out from the command center to every part of the body. So your arms, legs, finger, toes, everything. In this case, when the tingling starts, the tiny receptors in the skin of the arm and hand are picking up the abnormal signal. This signal then travels like an electrical impulse along the sensory neurons, all the way up to the spinal cord. Now here's where the reflexes come in. Most of the time, the spinal cord can initiate a response even before the signal fully reaches the brain. It sends a message right back out through our motor neurons, telling the muscles what to do, or in this case, perhaps telling them to stay still or react to the discomfort. This entire loop, receptor, sensory neuron, spinal cord, and motor neuron to muscle, is how our body reacts to stimuli, and it's how it's trying to alert us to a problem with the nerve. Next is the autonomic nervous system. This is part of our nervous system that works totally on its own. So without us having to think about it, it's doing everything. Its main job is to keep our internal environment stable and balanced. It's what we also known as homeostasis. And a way to think about that is if you think about how your heart keeps beating regularly, how you digest food without trying, or just how your body adjusts to the temperature. The autonomic nervous system manages all of that. So in our case study, the nerve compression isn't just affecting the signal for feeling and movement, it can also disrupt the ANS. If the compressed nerve is one that carries signals for blood vessels control, for example, it might cause blood flow to be reduced to the arm and hand. And the lack of proper blood flow can contribute to the numbness, tingling, and even like the temperature changes that the patient is experiencing. So, to sort of create a plan for our office worker, based off their symptoms of numbness and tingling in the left arm and hand, it's more than likely going to be just a nerve compression. This is common for people who sit for long hours, especially with poor posture, or those who do repetitive motions. It could be the median nerve in the wrist, which is also known as carpal tunnel syndrome, or it might just be a pinched nerve higher up, perhaps in the neck or shoulder area. Or it could be due to a herniated disc or just tight muscles. Our treatment plan would start with confirming the diagnosis. So that's going to start with imaging. We're going to get an x-ray, and then we're going to move on to an MRI, just to get a clear picture of the nerves and the surrounding structures. Once we know exactly where the pressure is, a primary treatment would most likely be physical therapy. Physical therapists can guide the patient through specific stretching and strengthening exercises to help relieve pressure on the nerve and improve the support around it. We'd also look at ergonomic adjustments for their workstation. So that is just maybe getting a new chair, adjusting the height of like their monitor if they use a computer, or keyboard, or even just getting like a different mouse, just to prevent the problem from coming back. So, but if these sort of conservative methods don't work, some other things that this person could used for some relief would be like anti-inflammatory medication, or if it is more severe, it's going to be surgery to release the compressed nerve. The rehabilitation would then focus on regaining full sensation, strength, and coordination in the arm and hand, and also just educating the patient on how to, like, just for preventative care so that this doesn't happen moving forward. Thinking about all these systems working together, the precision of the pathways of the nerves, constant balancing, active homeostasis, and the rapid reflexes, it definitely is inspiring, and it really feels like the evidence of a divine order and just speaks to the wisdom that was used in making us in our creation. It's a reminder that we are intricately and wonderfully made, as the Bible says in Psalm 139:14. I praise you because I am fearfully and wonderfully made. Your works are wonderful. I know that full well. This verse definitely resonates with me because when I look at how complex and perfectly designed our bodies are, it's hard not to see the work of a higher power, of just everything. Even in the challenges like a compressed nerve, the body's systems are trying to communicate and heal, and it's just reflecting that inherent design that everything was made with a purpose, everything was made for our betterment. And so I think that this case study really was a great one to highlight just the divine power that is literally moving with us in every movement, every day. So thank you very much.